Good evening, Facebook community. This is Jennifer with Uplifting Life Naturally, just hopping on here for my evening live broadcast. Going to talk a little bit tonight about Lyme disease. It, is kind of prevalent in our area, and I know a lot of people talk about it and get concerned about it. So I certainly wanted to hop on here and pass on a little bit of information. As always, I appreciate everybody hopping on, and I guess it's extra special tonight since the penguins are on. Hopefully everybody's just sitting, watching me as you're watching the penguins behind you. So anyways, I know it's exciting. My daughter wishes she was there, but I guess she'll survive watching it on TV. So anyways, I just wanted to talk briefly about Lyme disease, and basically what Lyme disease is it's a bacterial infection. Now, I am not going to even attempt to pronounce the name of the bacteria, but I'll make sure I post the name of it in the comments below for those of you who are interested in that kind of information. I just can't pronounce that kind of thing, so I'm not even going to try. So anyways, like I said, it's a bacterial infection, and it's actually transmitted to humans and even our pets by an infected tick, and typically it's a deer tick. And the ticks get infected by, feeding off of an infected deer or even infected mice. And then when we get bit by them, it transmits the disease to us. And, oftentimes we don't even know that we're bit by a tick, but, sometimes you do. And if you see it, you certainly want to make sure that you, take prompt attention and get that removed. If you haven't caught my lives from earlier this week, I did talk about all of that, and you can go back and reference that. If you can't find it, just drop a comment below, and I'll be happy to tag you in it so you can see that as well and get that information if you're interested. And for those of you who like trivia, the first case of Lyme disease was actually diagnosed in 1975 in Old Lyme, Connecticut, which is where the name came from. So maybe some of you can sleep now that we know that information. So as far as Lyme disease, there's typically 3 stages. Stage 1 and stage 2 oftentimes can overlap, and it's really kind of hard to distinguish. But, from a literature aspect, it is broken up into three separate stages. Stage 1 is the earliest stage. It usually occurs anywhere from 1 to 4 weeks after somebody is bit by a tick and the infection starts. The most common symptom with the early stage is the bullseye rash that is pretty common. I know most people are probably familiar with. Typically, it is bullseye, meaning it's a circular rash, a red circular rash with a white center. However, sometimes it can just be a solid red, and even in those with darker complexion, it can look more like a bruise. So, it's not always that typical bullseye rash. And, why that rash is actually occurring is because, that's when the bacteria actually, starts to multiply within our bloodstream. That's why you're starting to see that rash. From 1 to 4 months is typically, what's referred to as stage 2, and that's often where, people have some flu-like symptoms of headache, fever, chills, joint aches.
Lindsay told me to say hi to her. Is she still on there?
Oh, Lindsay's on here? Hi, Lindsay.
Why are you
I'm embarrassing my daughter. So, anyways, back to that, kids. Always distracting me. Sorry about that. So you get the flu-like symptoms, which are basically your headache, maybe a low-grade fever, chills, body aches. Sometimes you can even get a facial paralysis, which typically occurs on one side, also known as Bell's palsy for those of you who may be familiar with that term. But it's where we get a facial paralysis just on one side. And some people can even have some abnormal heart rhythms too during that stage. Like I said, stage 1 and stage 2 oftentimes overlap, and especially if somebody doesn't even know that they've been bit by the tick. Now, getting into the later stages of Lyme disease, that can occur anywhere from months to even years after being bit. And oftentimes people, don't even have a recollection that they've had the tick bite. They start just getting some generalized, symptoms really without any clear explanation. And, a lot of the basic testing and workup is coming back negative. So, as a healthcare professional, we need to keep that in our, list of possible diagnoses and check for that. But symptoms with later stage tends to be arthritis type symptoms typically. typically in your knees, but it can occur other times in different joints. People may have a chronic numbness, tingling of their hands and feet, and they may even start to experience some short-term memory loss, poor confusion, like a brain fog type of thing, and really have no explanation, for that. And again, even in the later stages, abnormal heart rhythms can be common as well. So, because, this can go on for months to even years, it's definitely important if you, have concerns of the early symptoms or you've identified a tick bite that you seek prompt attention. Now, if you're wondering how this is diagnosed, it's actually diagnosed through a simple history and physical exam and, confirmed with a blood test is usually what we do for that. And as far as treatment, that too actually is relatively simple in a sense, given, the severity of how the symptoms could be. But if you're diagnosed with Lyme disease in those early stages of stage 1 or stage 2, where you're having the bullseye rash and the flu-like symptoms, typically it's just treated with antibiotics for 2 to 3 weeks, and there are antibiotics taken by mouth. Later stages, if you're somebody diagnosed months to years later, same type of thing with antibiotic treatment. However, it's typically given through an IV for that, which is really the only difference on that. So that's just a little bit of some basic information on Lyme disease. I hope you found it interesting. I certainly appreciate everybody who's hopping on here. There's quite a few today. Hi, Lindsay Cassidy. I hope you saw Sarah hop on there. Otherwise, I am not good at individual names, but I certainly appreciate everybody hopping on. If this is something that you think somebody else can benefit from hearing, please make sure you pass that along. Check the comments here in a minute for the name of the bacteria for those of you trivia type people who are interested for that. And this will probably follow up in a blog information tomorrow if you want to share that as well. I'd certainly appreciate it. Any other questions, please jot them below. I'll be happy to answer them, and I will be hopping on here tomorrow evening, and hopefully I'll see you then. Have a great night, and back to the penguins. Good night.